Lisa referred to the Medicaid program for pregnant women who qualify, but that may not be the safety net you think. Here with that part of the story is the district's Stephanie Bethel.
Certain medical conditions are running on a time clock, pregnancy among them. While we have programs in Nevada designed to provide a safety net for lower-income clients who need medical services like Medicaid, applying for coverage can be paperwork-intensive, confusing, and time-consuming. At last count, 32 states have recognized that requiring a pregnant woman to race the clock, the stork, and the bureaucracy simultaneously is not conducive to supplying timely prenatal care. So they've developed Medicaid systems generally referred to as Presumptive Eligibility or Expedited Medicaid. But currently, these are not available in Nevada.
Presumptive eligibility is something that is available in many other states, and it's kind of a fast track. You walk in to a Medicaid office and you declare that you are pregnant, okay? Your application is processed within X number of days. Okay, and you are able to walk in to a physician's office with Medicaid eligibility on the books within a matter of a week.
Medicaid says that it takes about 45 days to get their application approved. If a woman who typically will find out at 8 weeks that she is pregnant, 45 days puts her out of the first trimester. So the system is flawed. There is no way a woman could get early prenatal care, which is defined as the first 3 months of pregnancy. Presumptive eligibility would be that we're going to presume that the woman is eligible for Medicaid. And so during those 45 days or 60 days that it takes for the application to go through the process, that woman can go to her doctor and she can get her blood work done, she can get the ultrasound, she can get all the necessary tests and appointments that she needs during that time. Expedited Medicaid instead takes that you still have to apply for the Medicaid, and they have to get it turned around in 48 to 72 hours to find out.
So Medicaid, when they say a client is eligible for prenatal services, they are basically sort of making a promise to the physician, we will pay for the prenatal care.
At a minimum, they could do the Medicaid office. The women are coming there anyway, so it's an easy point of entry, and just give a little plastic temporary card with an expiration date and say, hey, there you go.
Presumptive eligibility is only for the term of the pregnancy, delivery, and one postpartum checkup. It is not a blanket approval for a woman to remain covered past those events. In fact, even under our current system, Medicaid recipients' eligibility is regularly reviewed. Its purpose is to provide a path for prenatal care to try to cut down drastically on the number of premature infants or those with complications that might have been prevented by consistent prenatal monitoring.
If the state was to pay for a full pregnancy, the medical care for the mom, the prenatal care, the actual hospital delivery, all of that, a preterm baby averages 11 times more than an uncomplicated birth, including all of the prenatal care.
Preterm newborns generally require admission into a neonatal intensive care unit, or NICU, where the cost to all of us increases exponentially. Here's how the math breaks down. Costs for a full-term, healthy, normal pregnancy and delivery with prenatal care range between $3,000 and $6,000. For a C-section, they increase to approximately $12,000 to $15,000. The average cost per day for an infant in the NICU is $3,000 to $5,000. The average length of stay is a lengthy 23 days. This is how these children become known as million-dollar babies.
You'll pay for it one way or the other. You'll pay for it on the front end, or you'll pay for it 3 times more on the back end. And when you've got those million-dollar babies, again, that's just their hospital stay. That doesn't cover the cerebral palsy or the mental retardation, hearing problems, blindness, any sort of cognitive or emotional problems that the child might have. It's going to be paid for in your school systems with special education, or even with some of these children who unfortunately have some severe problems, institutionalizing them.
What are some of the reasons Nevada doesn't institute presumptive eligibility?
The opposition has been that it's too costly to put in place, that it might be considered a violation of the rights of others because you're singling out one group to be fast-tracked for their Medicaid eligibility. So it could be viewed as an unfair advantage to a particular group of individuals, basically pregnant women. The other problem is that Nevada Medicaid has historically not been as generous as many other states. And there have been concerns that one of the ways that we have kept our Medicaid costs down is by keeping somewhat of a cap on our enrollment.
I don't think there's so much an opposition to presumptive eligibility is that we are in Nevada, we're always trying to catch up, and it has to do with money, and we don't want to put the money out front. We have to pay it in the end. There's no getting around that, but we don't want to put the money up front because we see the numbers and we think that we can't afford it, and we all logically know that we're going to have to pay for it in the end, but we don't want to put the money up front. And I think that that's a great disservice that we do, not only to ourselves, but to the communities that surround us.
We need to fast track these folks and get them into prenatal care as quickly as possible. And then we need to make sure, this is the other side of the coin, I got very ornery about, we need to make sure that that mom and baby do not leave the hospital without the baby's Medicaid eligibility in place. When you cocoon a child from prenatal to about the age of 6, you give them those formative years to become a healthy, happy, tax-paying citizen, which is what we all want.
More information about UMC's Family Resources Center can be found on its website at umcsn.com or by calling 383-BABY. Information about programs provided by the March of Dimes can be found at marchofdimes.com/Nevada or by calling 732-9255. And information about prenatal care in the Southern Nevada Health District's Nurse Family Partnership can be found on our site, snhd.info.